Subscribe to our YouTube channel and press the bell icon to get the latest updates.
For the last year and a half, one disease has hogged headlines, mindspace, and some would say resources in India: COVID-19. But the collateral damage of the pandemic has also been huge. Screening for tuberculosis, for long considered India's biggest public health crisis, has gone down significantly since the COVID-19 pandemic hit India. This, even though, because of the striking similarities in the symptoms of the two diseases, guidelines had been issued last August for bidirectional screening for COVID-19 and TB. Let's look at the figures. In 2020, 17.19 crore people were screened for TB, with an additional 52,273 people being detected with the disease. Till June 2021, 4.87 crore people were screened, with 13,934 of them being detected with TB. Compare these numbers with the previous years, and the drop is sharp. About 35% between 2019, which was the last pre-pandemic year, and 2020. In 2019, 27.73 crore people were screened, and of them, 62,958 cases were detected. The active screening for TB started in 2017 when 3 rounds of national TB screening campaign were carried out, with more than 5.5 crore people being screened, of whom 26,781 were detected with tuberculosis. In 2018, 18.93 crore people were screened, and from this exercise, we detected 47,307 additional cases. TB kills an estimated 480,000 Indians every year and more than 1,400 every day. According to the National Strategic Plan for Tuberculosis Elimination, India has also more than 1 million missing cases every year that are not notified, and most remain either undiagnosed or unaccountably and inadequately diagnosed and treated in the private sector. This is a problem for 2 reasons. A disease as infectious as TB, when left undiagnosed, there can be many more cases from one single infection. And the second reason is that when a tuberculosis patient is not fully treated, there is a likelihood of the bacteria becoming drug resistant, and drug-resistant TB is one of the biggest problems in India and the world. These are the reasons why India started the initiative of active case finding through screening of vulnerable populations for TB in order to detect hidden cases. The Global Sustainable Development Goal, SDG as they are known as, the target is to eliminate TB by 2030, but Prime Minister Narendra Modi had announced in 2018 that India plans to do so 5 years ahead of the global target by 2025. Active case finding for TB suffered both because of lockdown, when it was not possible for health workers to visit people, and also afterwards because of diversion of the available health workforce for COVID-19. In a press statement last month, the Press Information Bureau, which is the communication arm of the Government of India, said that due to the impact of COVID-19 related restrictions, case notifications for TB had decreased by about 25% in 2020, but special efforts are being made to mitigate this impact through intensified case finding in OPD settings, as well as through active case finding campaigns in the community by all states. Moreover, there is not enough evidence currently to suggest that there has been an increase in TB cases due to COVID-19 or due to increased case finding efforts, the government said. There are, as I mentioned earlier, a lot of similarities between the symptoms of TB and COVID. That is why last August, the Government of India issued instructions that all newly diagnosed TB patients or those currently on treatment should be tested for COVID-19 before they are started on the appropriate treatment. Similarly, all COVID-19 cases should be screened for TB symptoms using the 4-symptom complex. These are cough for more than 2 weeks, persistent fever for more than 2 weeks, significant weight loss, and night sweats. Also, any history of contact with a TB patient should be taken into consideration. According to the Global TB Report 2020, India accounts for 27% of the global burden of TB and 31% of its mortality burden. It also accounts for 27% of the global cases of multi-drug resistant TB. In 2019, 24.04 lakh TB cases were notified. The number came down to 18.05 lakh cases in 2020 and 9.65 lakh cases till June 2021. It is legally mandatory for all TB cases in the country to be notified to the appropriate health authorities. That is all we have time for today. This is Abantika Ghosh signing off for now. Do subscribe to ThePrint's YouTube channel and become a member of our YouTube community where you will get access to exclusive content and other benefits. The link is given in the description. Thank you for watching.